Hey everybody, this is Dr. Philip Oob. I'm a functional medicine physician here in Austin, Texas, and I'm going to be speaking to my friend Dr. Andrew Greenland, who's a physician in London. And we're going to find out what's going on in London, as well as some of the things he's seeing in the ER, and maybe some other COVID-19 tips. Um, so
Sure.
I'm ready to hear what's going on in London, Dr. Greenland. Well, first of all, why don't you introduce yourself? Um, I know you as Dr. Greenland from London, but
Sure.
tell us a little about you.
Sure. So I'm Andrew Greenland. I still work as an emergency medicine consultant, but I also, as you know, have a big interest in functional medicine. So I do two very, very disparate things. And they don't really meet very much because at the one end, I'm dealing at the sharp end with life and limb-threatening stuff. And then I have my other extreme where I've got time and energy to spend with people unpicking their chronic, complicated disease process.
And that's hard to do.
So they're two very nice places.
Go ahead.
No, you go ahead. You go.
Well, I did that for a very short amount of time where I was working in the ER on the side while I was getting my business started. And it was not easy to put on that ER hat and not necessarily ignore the functional medicine stuff, but just not practice it, not have as much time, and then go back to my practice and switch hats. And now I have 90 minutes with a patient. It was very unusual and it was disruptive. So I'm impressed that you can wear both hats and do it well.
Well, I think the functional medicine is a nice antidote for the day job, which is extremely high pressure, high intensity. You're seeing literally people at the end of life and in very, very, very extreme medical conditions. So the functional medicine is a nice antidote to that because you then have got the time to spend with people to sit and unpick their things. The setting is completely different. The context is different. And they don't really mix because you can't really bring functional medicine into the ER. I mean, you'd like to, you can, but when you've literally got, which is what emergency medicine really is at the end of the day.
Yeah. So give us an update. What's going on in London? And remember, we're here in America and have no idea what's going on in Europe because America is selfish and only focused on America. So what's happening in London? How are you guys faring? And how's the ER?
Okay, so I feel like about a week ago, I woke up in a parallel universe and the world has changed. We're currently in a state of essentially lockdown. So everybody is being told to stay at home. All the shops are closed apart from food outlets and pharmacies and just places where you can get essential bits. And essentially a curfew one. You have to really have a good reason to be going out. So you're only really allowed to go out to get shopping, essentials, go to work if your work is essential. And you're allowed to go out to exercise once a day. So it's pretty extreme stuff. It feels like we've woken up in a war. And we are in a kind of state of lockdown at the moment. As to the ER, again, it's a completely different universe in hospitals. So, I mean, every hospital is essentially a COVID hospital. The system is getting completely overwhelmed. On the one hand, it's interesting actually, because our overall numbers of attendees have gone down. So everybody's being told to stay at home and people are staying at home. And the only people that are turning up to the hospital are people who are worried that they have coronavirus, and want to be looked at. So the numbers have gone down overall, but we are getting swamped with suspected COVID cases and they are sick. I mean, the hospital is full of COVID and we're not the only ones. So I work in a hospital in West London, but the whole health service is completely swamped. And the sick ones, there aren't enough ventilators for the sick ones.
Really?
The whole hospital system is just completely swamped. So it's a very odd place to be working at the moment. There aren't enough staff because the staff are dropping down like flies, because as soon as a staff member has a symptom suspected of COVID or corona, they have to isolate for a week. So even if they've got a minor cold or just a minor flu, we have to presume that that might be COVID until proven otherwise, and they have to isolate. So that's completely depleting the health service of the staff. There is a scarcity of protective equipment. We should all be wearing, fairly high grade protective gear, and there isn't enough because this has just completely taken the health service by storm and hasn't really given any people opportunity to get the right stuff in. So we haven't really been protected properly. So it's a really difficult situation at the moment. And this is only the beginning, and we're expecting things to get pretty bad in about 2 weeks' time. So if we look at the modelling from Italy as to where they were at the same place that we were when they had their massive hike. Sorry.
So you guys are going to get worse. You're already kind of sounding like you're overwhelmed, and it's going to get worse still for 2 more weeks.
Yeah. Yeah, well, we reckon that if we look at the modelling as to where Italy was when they had, I mean, Italy had a huge number of COVID deaths, and their situation was probably the next worst after China. So if we look at where they were at this point in time as to where we were, about 2 weeks from now, this brand stuff is really going to hit the fan. We are really anticipating big problems in about 2 weeks. So there's already, the country has gone into sort of emergency mode. There's talk of opening a exhibition space somewhere in London to create a COVID hospital for 4,000 people. To give you some sense of what we're expecting. So it's basically like a stadium where they're going to convert into a hospital, because that's the kind of the scale of the numbers that we're anticipating in about 2 weeks onwards. Now, hopefully things will be wrong. Hopefully the isolating that everybody's doing will help to keep the numbers down, but that's really the grim reality, that things are going to get quite a lot worse in about 2 weeks' time.
So I've been kind of watching the Johns Hopkins graph and watching how the US has been doing. I'm looking at the United Kingdom one right now, and you guys are on a vertical rise just as bad as the United States. Now, your numbers are clearly a lot lower, but I'm assuming that's just because your population is smaller. So you're saying that you guys are already struggling, yet you're still in an exponential growth phase despite all the distancing you guys have done. And you guys are ahead of us. We've still got tons of people going to work. And yes, they're all critical infrastructure things, like, in my opinion, daycare should not be open and liquor stores should not be open. And there's all kinds of, if you look at our critical infrastructure sheet, pretty much anyone can justify their work as critical infrastructure. So it sounds like you guys have done a better job, yet you're still exponentially growing and you're already overrunning the hospitals.
Well, we probably haven't done as good a job as you're suggesting, because the real kind of, the real heavyweight social isolation really has only come in within the last 5 days. We had sort of basic advisories were out about a week, 10 days ago. People probably weren't paying enough attention to them, so they've got quite heavy. Certainly towards the end of last week, and as of Monday, that's when people were told that they couldn't go to work and they had to stay in. So it's got quite heavy, but that's only been in the last few days simply because we're just not getting on top of it, and people haven't been behaving. You know, there were people out on the weekend in restaurants, bars, clubs, etc., and not heeding advice. So basically, the government have now shut down all clubs, bars, and restaurants just because we weren't doing as much as we should do. So we've only really started paying attention as of this week.
Well, I'm sorry,
probably a bit too late. You know, we're on this exponential phase, and that's, yeah. So it's quite difficult times at the moment. You know, it's the staffing is a big issue. The resources are an issue. The hospitals aren't really coping very well, and things are going to get worse. I mean, as regards to the numbers, so the latest stats are that we've done 97,000 tests, of which 9,529 are positive. And we've had 463 deaths to date. But we're only at the moment routinely testing those patients who are admitted to hospital. That's as far as the testing is.
So you guys aren't testing the general population that are sick?
We don't really know what the scale of this stuff. Oh no, we haven't got that far yet. I mean, that's probably 4 or 5 weeks down the line. So this is just people who are admitted to hospital. So we're testing pretty much probably the sickest ones, or the people who are most likely to have the virus. God knows what else is out there. We don't even know.
I mean, I'm flabbergasted because I'm looking at y'all's curve, and you are straight vertical. Obviously not straight vertical, but very exponential growth. And it sounds like you guys have worse testing than we do in the US, and it's pretty atrocious around here. So, gosh, Dr. Greenland, so what are you doing to kind of protect yourself as far as supplements, vitamins, diet, whatever, standing on your head? I don't know.
Sure. Well, I'm doing my best. I mean, when I am in the when I am in the danger zone at work, I am making sure I am as protected as I can. So wearing the full kit: scrubs, visors, high grade face masks, double gloves, aprons, you name it. We're trying to protect ourselves as best we can whilst we're there. And then what I'm doing in my usual life is to do a really healthy diet, plenty of vegetables, plenty of fruit and vegetables, no junk, plenty of water. I'm taking quite a lot of vitamin C at the moment, and just basically things to boost my immune system: glutathione, zinc, just the general multis that I already take, and just plenty of phytonutrients. That's really all I'm doing, and just trying to keep as well as I can, sleeping well.
The big question I keep asking, I'm not in the hospital right now. I imagine
Mm,
if this situation gets as bad as it is, I'm going to end up in the hospital or the ER. Not personally, I mean working, hopefully not personally in the ER or hospital. I had enough of that in January. I don't want to do it again. But my biggest question is, how many people under
sure.
50 and under 60 are you seeing that come in with serious illness? And how many of those, I know this is a complicated question because there's such a delay, but how many are under 50 coming in with serious illness? And how many of those that are coming in under 50, did they have other comorbid conditions, or are we seeing actual healthy people that are getting really sick, or is it only the comorbidities?
I think it is people. I think it is generally in terms of the people who are coming through our doors. It is the elderly and people with comorbid. Well, I've not personally seen them, and I think they're a rarity. And because they're a rarity, they might be the ones that are getting reported. But my general sense is all the people that I'm seeing have got chronic illnesses: diabetes, cardiovascular disease, cancer, immunosuppressed, on steroids, asthmatics, respiratory illness. They're all the people that seem to be sinking with this. And then, as I said, there may well be one or two freak well people, but I get the sense it really is, as the government is saying, it's the people who have got the comorbid illnesses that it's really sort of striking down.
So I'm not hearing anything about children, like under 20. I'm not hearing anything. I don't know if you guys see peds in your ER, if y'all have a separate pediatric section, but are you seeing any kids getting sick, or the kids are just the carriers?
They seem to think that the children are the carriers, and we've not seen any sort of serious illness in the kids, which is very, very helpful, because it's basically given us some capacity to use the children's areas that would otherwise use for other things to start seeing other stuff there. So it does seem that the children have got away with this, which is lovely, and we think it's probably they are mainly the carriers. But unfortunately, it took a very long time for them to shut the schools, because I suspect that they were worried that the public wouldn't cooperate with everything they wanted to do. So the schools were only closed last Friday, which in relation to some of the other countries was quite a late decision to make.
Yeah, I got to give us credit. We closed the schools, at least in Austin and in Texas. We closed the schools pretty quickly, but not a lot of other stuff closed. So I don't know that that really did a whole lot of good. Are you guys having to turn patients down at the ER? And are most people that are showing up, are they just worried that they're going to die because they have COVID, or are they actually sick?
So the numbers of actually attending have gone down, which is good. So people are following advice about not going to hospital unless they absolutely have to. So the ones that are sick, I think our threshold for what we would do with them has definitely gone up. So the threshold for admission for anything, regardless of what the problem is, has definitely gone up, because we just don't have capacity. So even those ones that we suspect have got COVID, and it's only the ones who really aren't managing their illness, who are in respiratory compromise or in ARDS, they're the ones that will be getting admitted. Everybody else will be sending home, COVID or otherwise. And interestingly, even the ones that we suspect that have turned up with COVID, they're not getting tested. We are literally only testing those patients that are getting admitted to hospital,
How long is it taking you
because we
guys to
just
get
don't have
test
the
results
testing
back?
capacity at the moment. So there's a whole about 2 days. So they're doing the PCR swab test at the moment. So the turnaround time is around 2 to 3 days. So we've got wards at the hospital with suspected cases, and if they then get confirmed, they're then moved to a sort of confirmed unit. And the hospital is practically full of COVID cases. I mean, that's just the state of play.
So you mentioned earlier that
So it does
there
make
was
you
a
wonder.
shortage
All
of
this,
ventilators, and I was just curious if it's a true shortage, and if you guys are having to pick who's living and who's not getting a ventilator.
yeah, I think that there is a true shortage, and there are some very harsh decisions being made. I think, you know, if the capacity was there, there would be extra people that would be ventilated, and some people have to be making very harsh decisions based on who is likely to pull through this, because there just isn't enough to go around.
Yeah, I think
There aren't
now,
enough people qualified to intubate the patients. I mean, this is where we're at. It's absolutely dire out there.
that's scary. I've only done a handful of intubations in my life, and I would not consider myself an expert at all. But I guess I could intubate someone better than someone off the street. So hopefully they won't need my services. But I think now is a good reminder to anyone watching that it's a great time to talk to your mom, your dad, your loved ones about if they do get sick and if they do end up on a ventilator, is that something you want for them? And if they are elderly and very sick, is that how you want them to remember their last days as far as being on a ventilator? Because if they don't, then they should consider making themselves do not intubate, DNI. And this DNI order will not waste a ventilator for someone possibly healthy who could use that ventilator. But of course, waste, that sounds terrible. I don't mean to say that that person's life isn't worth it, but it's important to know that if you are elderly and you do have all these comorbidities, you may not survive even if you do get intubated, and you might have taken up a ventilator that could have been used for someone else. So I think now more than ever is a great time for us to really assess what we want out of our life and how we want to die. That's not something we talk about often in medicine, is how we want to die. There's a good article that gets circulated around the internet every now and then that's called How Doctors Die. And it's morbid, it's dark, but the idea is there's a lot of things we can do in medicine, and Dr. Greenland could probably talk about it for hours. There's a lot of things we can do to people that are just terrible and don't extend your life any and don't give you much quality. So this is my urgency to tell everyone: go talk to your loved ones and find out if that's in fact what they want, to be on a ventilator, if that's their last thing they remember on this earth. And if they don't, get the order signed that they're DNI, so that they can have a peaceful death. And there's nothing wrong with having a peaceful death. And on that monologue, it looks like Dr. Greenland has dropped. So let's see if we can get him back on camera. Dr. Greenland, can you hear us or hear me?
Hello. Yes, are you back? Can you hear me?
Yes.
Good, back on. Yes, no, I did hear what you were saying, and I think you make a very valid point. And I think those difficult conversations do need to be had, and we're certainly we're having to make very difficult decisions, literally on when patients arrive, regardless of the state of their illness, because we have to kind of foresee what the direction of travel that some of these cases may take. And we are seeing some of the sickest patients, and they're not all going to do, unfortunately. And we have to make harsh decisions about, you know, who is going to be suitable for more intensive treatment and who isn't. So those kind of decisions are being made. We are putting treatment escalation plans in place for people to try and get some sense of control over the situation.
And I think another good reminder for people out there is that there's no guarantee that anyone's going to make it through this COVID-19. Now is a great time to hug your loved ones that you're quarantined with, tell them how much you appreciate them, write them a letter or whatever it may be. And the loved ones that you can't be with, find a way to contact them. If there's an estranged family member or some sort of issue that's come up, now is a great time to say, you know what, it doesn't matter. I forgive you. Let's hug this out, or not hug it out in quarantine. But it's time to work out those issues and come together and use this time as a good time. I've seen several photos of, you can't go into a nursing home, obviously, right now because of the quarantine or isolation, but I've seen several photos of what family members are doing is they're going outside of the window of their nursing home elder or loved one, and they're kind of talking and waving through the window, at least to have some connection. Now, that's probably cut off now with the isolation, but I know elderly aren't the best with telecommunication, but any way you can reach out to your loved ones would be a good idea. That's okay. And COVID is even affecting the internet.
Yes, indeed. Well, actually, you say that, but it's probably because there are so many people at home trying to work from home. It's probably completely saturated the system.
Exactly. I completely believe that.
Because everybody, literally, you can only go to work if you're a key worker, you're an essential key worker, and everybody else is being told to work at home. And there's an absolute capacity they must work at home.
So the
everything is literally
Netflix
shut down.
streaming is destroying our internet. Too many people are streaming from Netflix.
Yeah, exactly. Some people are just doing 24/7 Netflix at the moment, I'm sure.
Yeah. Well, they need to start streaming my videos instead. Turn on YouTube and look at my
Quite
videos
right.
instead.
Quite right.
So we got interrupted a moment ago, and this is much better. There's a lot less delay. So I had kind of gone on a monologue as far as nursing homes and stuff. I didn't know if you had another point to say about that or any tips.
Yeah, so I think I've tried to say, and I keep getting cut off, but from this side, so the elderly and those with chronic medical conditions, of which there are 1.2 million people, have been written to by the government specifically, telling them they need to self-isolate to a much higher level than the rest of us. So for 3 months, they've been told they really must stay inside and not have any contact with anybody outside of their household. And any shopping needs to be brought in by volunteer services, and they really must stay in. So they're the ones that everybody's worried about, and they really have been told to sort of shut themselves away. So same with nursing homes. Nursing homes aren't accepting visitors, as you mentioned in your conversation just now. Really trying to protect those that are highest risk, because the thing is, we probably are, most of the population are going to get this thing, and for most people it'll be a mild illness, but clearly not for those who are more elderly and vulnerable, and those are the ones we're really trying to protect with the whole isolation thing.
Agreed. You mentioned earlier, as far as healthcare workers getting sick and the hospitals already on decreased staff. Are you having to work extra shifts, or is that something they're talking to you about, saying that, hey, get ready because you might have to pull more shifts, or how does that work?
No, I think they have to realise that we are not an expendable resource, and there's no point in trying to burn those who are working out so that we then become sick when things really kick off. So we are working under extreme pressure and with fewer staff, and we're just having to manage as best we can. The rest of the hospital is having to completely change their way of working, because there's a lot of activity in hospital that is no longer happening. So elective surgery is being cancelled, elective outpatient clinics are being cancelled, anything considered to be routine has been cancelled. So all the people in the hospital that were doing those roles have now been redeployed to try and sort of keep the hospital running in this sort of state of crisis. So there are probably a lot of people who are doing things quite outside of their comfort zone in this new world that we're in.
Mm-hmm. And what you did a great job of answering the question I was really worried about before, is as far as like people that are otherwise healthy without any chronic conditions are not showing up sick. And just to remind people what he said things like diabetes and high blood pressure and obesity. These are not typical things that people would consider themselves sick because they have a condition, but that does raise your risk, even if it is just diabetes. Just because 30% of America has diabetes doesn't mean it's okay to have diabetes. That definitely puts you at higher risk. But that aside, Dr. Greenland, what would we lost him again. So I don't know if you heard me ask the question, but because I took a long time to ask it, the question was something like, what can we tell people that are at home and are sick, as far as having a fever, not feeling well and all that? What can we tell them as far as what signs should they look for in order to consider going to the hospital? Because we want to keep people out of the hospital in order to save resources for people that are ill, but at the same time, we don't want people showing up dead. So what are some of the signs they should look for to go to the hospital?
Sure. So as far as we know at the moment, the generic symptoms of this illness are a new, dry, persistent cough, a fever, and breathlessness. And obviously there's a lot of variations on the theme. So a lot of people have sort of cough and cold or flu-like symptoms, but those are the three classical symptoms that we're all on the lookout for. In terms of when do people need to go to hospital, if people are not managing their symptoms, that's the point where they probably need to have some kind of input. They don't need to go to hospital if they suspect that they have the condition at the moment, certainly not in the UK, but if they're not managing their symptoms and their breathlessness is becoming a problem and they literally just can't walk, more than a few yards or whatever, then we do need to see those people. Now, it may well be that we will see them and turn them around and send them back home, but at least we can see them with the benefit of a chest X-ray if they need that, and we can measure their oxygen levels, etc. But it's really that group, people who are not managing their symptoms, not people who are just worried about the fact they may have it, because the treatment at the moment is going to be the same. It's going to be, well, if you can manage your symptoms, then you need to go at home, you need to isolate yourselves and your family members.
Yeah. So I think that's good advice. There's another physician in London that I've met through the grapevine. His name's Dr. Nish Joshi. And I don't think you two have met yet, but I need to introduce you to. But he came up with a really good idea to give people comfort, as well as get people to the hospital maybe before they show up dead and saying, oh, I'm fine. And then they're showing up too late. And at that point, they can't even be supported by typical measures, and they got to be put on the ventilator immediately. So he came up with an idea of breath holding as an experiment to see if your lung capacity is decreasing. So him and I have been encouraging people to do a breath holding test. How long can you hold your breath? And however long you can hold it, you write that number down, and you do it even when you're well. And then as you get sick, you keep recording that number. And if that number is dropping, then that's giving an indication that, hey, you might be one of those people getting more serious disease. And it may be time to call your local doctor and see if they can help evaluate you and give you that decision whether you need to go to the hospital or not. But also it can help if you're dropping too steeply, then that's a sign saying that you're not just short of breath, you're actually losing real lung capacity. So what do you think about that? I clearly have no science or data behind that whatsoever. It's just something that makes sense. Do you think this is logical for people to do, or are we leading people astray?
I like it. I think it's very tangible, something that people can easily do and they can get a number for. So I think it's a very pragmatic solution. I think it's very practical. I like it.
Okay.
Either that, or how many feet can they walk, or just some tangible measure they can note down, as you said, and then they can see how it's changing with time. So I think that's actually a very useful thing. Clearly, we haven't been validated, but I think it's a very good practical thing for people to do in this sort of uncertain time before we get better testing and what have you. Because the other thing I didn't mention is that we're not even testing healthcare workers at the moment.
Really?
And that's one of the big controversies. That's one of the big controversies in the UK. We are literally only testing those patients admitted to hospital.
Wow.
Nobody else. We're not even testing healthcare workers. That's hopefully going to be the next thing to come in. And I know the UK have just ordered 3.5 million kits, but that's not going to happen overnight. So it's going to be a while.
Which total population?
Our UK population, 60 million.
Okay. Wow, so 30 million should cover the most of it, because the number I'm hearing is that pretty much the entire world can expect that 75% of the population is going to get this. At the high end, the low end is 33%, but I think the way this virus is spreading, we're definitely on the 75% curve, maybe a little bit lower. I think the people that live very rural and are already isolated are the only reason it won't reach 100%.
Yeah, no, I agree. And I think the difficulty at the moment is that we don't know who's had it, who's got immunity, and there's obviously a lot of people that have got it, but we still don't know. We're making educated guesses. We're basically tell people to stay at home if they've got symptoms, and if they don't become sick enough to end up in hospital, we don't actually have a tangible piece of data to say that yes, you've had the virus. So we are working in the dark, and so the tests that we're doing, that's why we have such a high proportion of deaths in the people who are testing positive, because we're only testing probably the sickest patients.
Right, so it's going to abnormally make your mortality numbers look higher, which you guys.
So you have to, when you're looking at the sort of the numbers between countries, you have to kind of bear in mind the testing strategy that each country is using, because ours are probably skewed towards the fact we're only testing the sickest patients because they're the ones coming into hospital.
It looks like online, and this is just the Johns Hopkins numbers that I'm using. It's a hospital here in the U.S. that put together a dashboard of numbers, and it looks like you guys are rocking a 4.8% mortality based on the number of deaths and the number of cases.
Yes.
But that's just like you said. It's because you're not testing young, healthy people to change that denominator, so to speak.
Exactly. That's exactly the thing. So it's not that we're, the virus in the UK is any worse. It's just that the testing strategy is slightly different.
it looks like Italy, to do their numbers real quick, as of today, the best numbers I've got is they are still at a 10.1% mortality rate. I think when I did it a couple of days ago, it was almost 11%, but yeah, they're at a 10% mortality rate. I don't know anything about Italy. You might know more as far as, are they having the same issue as far as not testing
So again,
enough healthy people?
Yeah, I don't know what their testing strategy is, but I would probably suspect if it's as high, that percentage is that high, then they really are at the sickest end of the spectrum in terms of who they're testing. But I don't know how they're doing things for that. I don't know how many tests they've done, and I don't know who they're doing them on.
So let me ask you an opinion question, and this is totally opinion. Don't feel like you have to answer it, but I feel like China has kind of beat this virus and is doing really well. I'm not hearing a lot of death and destruction coming out of China. So are they hiding information, or did they really tackle this correctly? What's your take on it?
Hello?
Did I lose you?
I don't know if you can hear me, but the line's breaking up, and I didn't hear any of your question, I'm afraid.
Okay, can you hear me now?
I can get a better stream. That's better, that's better.
Okay, so it was an opinion question on, I really haven't heard much out of China, and I don't really watch the news. I get most of my information crowdsourcing through Facebook and the like, and resources like you, my little brother and whatnot. And so I'm curious, like, did China actually beat this virus? Are they hiding information? What's your take on their situation? Did they do this right and that's why they've plateaued, or what?
I think this is the thing. We really don't know whether we can believe the information coming out of China. We really don't know whether we're being given all the information, whether things are being doctored, for want of a better word. It's a very difficult situation to be fully aware of. I really don't know what's happening in China and whether the information coming out is still accurate.
All right, well, that's most of the questions I have for you, Dr. Greenland. If there's anything else you want to say, tips, anything on your list, I'm all ears.
So, I've been quite selfish and just focusing on what's going on in the UK. So where are things at with you locally, and where do you see this going in the US based on your experience in your clinic and what have you?
I am unfortunately somewhat terrified of what's going on in the US, because it's easy for me to look out and see what you guys are doing right. And I think I thought you guys were a little ahead of the curve, but it sounds like you guys are kind of following the same footsteps we are. We're just a few days, maybe a week behind y'all. I don't think people are, it's not that I don't think, I know people are not taking this seriously. I live in a fairly healthier town. Austin, Texas is known as one of the healthier towns in America, and kind of like LA, there's more vegans here per capita than anywhere else. So that usually means it's a little healthier. Yeah. But even with that, so many people are not taking it seriously. And there's, as I said already, there's people that are considered essential, what do they call it, critical infrastructure in America. And we were laughing last night over Facebook and text messages and stuff, because if you look at the list of all the people that are considered critical infrastructure, it's a laughing stock. Almost anyone can consider their job a critical infrastructure. Alcohol, did you know alcohol is considered a critical infrastructure? Like, we can't have people going into, yeah, I'm not kidding. So stuff like that is happening. And then on top of that, I'm currently fighting my landlords for a lease extension, because my lease, and I'm losing, unfortunately, I'm going to be homeless in about 5 days. I cannot move into my new space because one second.
Do you have headphones for
yeah.
computer? Sorry.
Does she need one with a microphone or without a microphone?
The microphone. I'm just going to call
oh. Well, she can use that one. She'll just have to use her computer microphone, which is fine. It'll know if she plugs it in. So people in America are not taking it seriously, to put it simply. And I remember what I was saying. I was talking about the landlord. So my new build out is not ready yet, and my current space, they don't want me to stay. There's some people that I've irritated because I'm doing COVID-19 testing and I'm not in a medical only complex. There's a daycare below me and there's a school next to me, and the daycare remained open as long as they can. I think they might even still have children there today. So they're upset that I'm doing COVID testing, even though we're doing it outside. They're not at risk at all. But my landlord, because of liability, they don't want me here at all. So they're in the middle of a healthcare crisis and a pandemic throughout the world. I'm being evicted, one of the healthcare workers that are staying in business, because a lot of doctors have just closed their doors and saying, nope, we don't want to deal with it. We don't want it. We want to keep our own family safe. There are doctors in America self-prescribing hydroxychloroquine and azithromycin to store it and have it for themselves. And quite frankly, that's incredibly selfish. And we're just like we're running out of toilet paper and everything else in the grocery stores. If people keep hoarding things, then the people that actually need this stuff won't be able to get it. And you're going to feel pretty regretful. You should feel resentful if people die and at the end of this, you still have leftover hydroxychloroquine and azithromycin when in fact you could have given that and possibly saved someone's life. So I'm not hopeful with where we're at. And I've got a physician colleague that is completely denying that this is happening. Not denying that it's happening, but he's of this idea that everyone that's young and healthy is going to survive. Yes, most of them will, but I just recently had my hospitalization in January. If a healthy 38-year-old can get chest tubes for 5 days, I'm scared of this thing. And I don't know if I had COVID or just bad luck, but I secretly suspect that I had COVID, and I'm waiting on the antibody testing to come through so I can prove or disprove that. But if a healthy 38-year-old without any comorbid conditions can get that serious of a hospitalization, this is going to completely overwhelm the American system. And I think our arrogance is going to get us this time. It's going to hurt.
Yeah. And just a question I have actually. So where are you at with testing in the US? What sort of level of testing? Who's going in, and what kind of testing are you managing to do? Because we are definitely behind here. Just interested to know what you're doing in the US.
I think we're hearing where you're at. We're ahead of you guys, but it's still shambles. The issue is that in the beginning we couldn't get any test kits, and now we've got quite a few test kits. And it seems like a lot more of America has test kits because they opened it up to the private sector. And so the private sector was able to multiply and get a lot of test kits out. The problem we're having right now is that it's taking forever to get results. So I'm still waiting on results that I sent a swab 8 days ago and still haven't gotten the results yet. Now I've used multiple different labs. So another lab, I got one back in 48 hours, but you just don't know until you send it. And the labs are lying because they just want you to send specimens so they can make money. And they're all saying, oh yeah, we'll get it back in 48 hours. But here we are 8 days later, and this person is going to be symptom free by the time we get their results. So I think we're ahead of the curve as far as sending out tests, but as far as getting results, we're way behind, way behind.
Okay. So, I mean, I've been looking into the antibody test, and I think that will be a game changer for us in the UK. If, say, we can get hold of home antibody testing kits en masse, so people can do them at home and not turn up to hospital and saturate the system. They get a result within 10 to 15 minutes. And I think that'll be a game changer for us.
I do
and
too.
even if we can just start with the healthcare workers. So if we can actually identify those who have, they've had their illness, they've got immunity, and get them back to work, it will really help to save the health service. Because at the moment, we've got, in my department, we've got 10 of my colleagues and doctors are self-isolating because they have symptoms. And they're basically out of the equation for a week.
And then if they get symptoms while in isolation, then it's 14 more days from that. I don't know that that's the wisest decision. You've got to wait at this point with the healthcare shortage. You guys are going to have to change to where you don't get isolated until you come down with symptoms, because that will not be sustainable.
Well, as one of my colleagues, her son came home from school with a cough, and now the entire family have to isolate for 14 days, and she's a consultant. So she's out of our equation for 14 days because her son came home from school with a cough. And this is what's crippling the health service, where everybody's dropping down like flies. And a lot of these people won't have COVID, but because the symptoms are so much overlap between that and the sort of common seasonal illnesses, we have to treat them as if they are a suspected case.
I think that's a tough position because, you don't want them spreading it around being asymptomatic, but at the same time, you can't overwhelm the healthcare system. So that's tough. Exactly. I know the CDC released guidelines for CDC's, that's our Center for Disease Control here in America. that issues the rules that we try to follow. And they released separate guidelines for healthcare practitioners. And even they admit, like, this isn't the greatest thing we should be doing, but this is the best that we can do in order to keep the healthcare force in work. And my little brother is telling me, I don't know if you guys are experiencing this, but my little brother, he's an internal medicine doctor in Baton Rouge in Louisiana. And he's saying that he heard that healthcare workers, or this is research, this isn't just heard, but healthcare workers are the ones that get the sickest, and they think it's because of the bigger viral load at time of exposure. But he said the healthcare workers have a higher mortality rate than the general public. Is that what you're hearing?
I've heard rumours, but then you obviously only hear about the sort of sickest ones that make it into the paper, but it doesn't make sense. We don't really know what the viral load and the impact on the prognosis for that individual is, but it certainly makes sense. And the ones that made the papers are, the nurses and what have you in ITU, who have actually made it into the national press. But we don't really have a full sense of the numbers at the moment. But it kind of makes sense, which is even more worrying. Particularly when we haven't been protected optimally from when this kicks off with having the right equipment. Especially now they're saying that the virus can survive in air for 8 hours.
Oh, I haven't heard 8 hours. I've been hearing the 3 hours. What's the 8-hour story?
There was some information coming out early in the week saying up to 8 hours. So it makes a nonsense of where you're working. If the whole hospital is basically you're inside a hospital, then you should be in gear the whole time, not just in particular areas or when you're exposing yourself to particular patients. If there's any truth in that.
Yeah, that's spooky
I
because
don't know, but
there's just not enough isolation rooms. And so earlier you mentioned that you guys were building a kind of a temporary hospital out of a stadium or something like that. And I'm assuming it's because there's not enough isolation rooms in the hospital. So you're trying to separate, hey, here's our COVID unit. Anyone that's sick with COVID, they go there. Anyone that's regular sick, because all this focuses on COVID right now, but we forget that there's natural sickness going on too. People breaking their legs or people spraining things, where I guess that's all ortho stuff, but strokes, heart attacks, those are still happening regardless of COVID. And we need to keep those patients separate. So in a similar ventilation hospital, it's going to spread to the people that are not there for COVID at all. So I guess that's the reason for the temporary hospital.
Yes, I think that I agree. And I think one of the things I was just going to mention on the back of that comment was that there's probably a lot of people at home with their chronic illnesses, and they are sitting on things they would otherwise have gone to hospital for in the normal world. And they are actually deteriorating, and they will be even more susceptible to COVID and even more susceptible to significant morbidity and mortality by virtue of that. And it's just evidenced by the fall in numbers. We can't suddenly have all these people that have suddenly become well at home. They're clearly sitting on things at home and probably, worsening their prognosis by doing so. And it's because they've had the fear of God put into them. They've been told to stay at home, don't go to hospital. Yeah. And so their threshold for attending and seeking help is going to be much, much higher.
That's wild. I'm also hearing from my little brother that and this is kind of new. I don't know if I've heard anything about this, but they're saying that they had a STEMI, a actual heart attack. For people listening, a STEMI is a heart attack where it's a major heart attack, not just like, I had a mild one at home. A STEMI is a major heart attack and can kill you. And they're saying that they had a STEMI case from COVID that wasn't due to plaque buildup. Have you heard of heart issues with COVID yet?
Not specific cases, but I mean, they've been put into the high-risk group, and it does make you wonder whether you are more likely to have an ischemic event if you're a COVID patient. Because they're actually saying that hypertension, uncontrolled hypertension, is a more significant risk factor than ischemic heart disease in their hierarchy of comorbid conditions.
Really?
So it wouldn't surprise me if there was a link in these cases that is not related to plaque buildup that increases your risk. It wouldn't surprise me. I haven't got any data, but that wouldn't surprise me.
And he's also saying that that people can get myocarditis, which is actual viral infection of your heart, and that's common. We know about that in medicine. Most patients don't know that you can get a viral infection of
Mm.
the heart. It's rare. We don't see it often, right? I definitely don't see it in the outpatient world. But he's saying
Mm.
that with COVID, 7 to 10 days after initial symptom, patients can get onset of myocarditis. So I'm guessing you haven't seen any myocarditis, viral inflammation of the heart yet.
I haven't, but maybe that's rather than them presenting in extreme as before, maybe they are literally dying before it happens. Maybe that's the whole thing. Where there's a whole raft of things we're not seeing because people are dying before they get a diagnosis of COVID, but not necessarily what may be underpinning it. Perhaps, I don't know. Wouldn't
And
surprise me.
I'm getting a lot of patients in America, my outpatients that are young and healthy and able to stay home. I'm not talking to them in the hospital, but none of mine have gone to the hospital yet. But I'm getting a lot of my patients. We don't know if they have COVID yet because of delay in testing, but it's presumed COVID. And they're almost all of them are saying that at some point in their illness that they got chest pain. Now we're focused on the lungs, right? Because it's such a lung-eating virus. But I wonder how much of this chest pain, because a lot of them are pointing to that central area. I wonder how much of that chest pain is just from viral inflammation of the heart itself, or the sac around the heart that we call the pericardium or pericarditis. I'm curious at what this virus is doing to the heart, and are we not looking enough?
Yeah, it could well be. And I think that, we've got these core symptoms, but I think that list of core symptoms is going to become ever bigger. And it's going to be ever harder to distinguish between COVID and many other problems because we've just had somebody reporting this week that loss of sense of smell is in the list. And all of a sudden, some people are getting anosmia and gastro symptoms are cropping up. So I think that symptom list is going to become ever bigger. And it's going to make it even harder to start screening people who are at risk because literally any symptom is going to count.
That's what I've been telling people. It doesn't matter what symptom you have right now with a global pandemic. If you have any symptom, you are presumed as having COVID until you test and prove negative. And the point on the test and proven negative, I still don't even believe the test being negative. In my opinion, you are COVID and you need to isolate for 14 days. The flu swab for us, I've always been told that the sensitivity is only 60%. It misses 40% of true flu cases. Well, if that's the case for a flu swab that we've had around for years and years and years, I can't imagine that this COVID swab that was created in the middle of the night on a global pandemic and urgency is any better than 40%. So I believe that our numbers are drastically reduced because our test is probably missing 40% of people. What do you think?
Yeah, no, I agree. And I think that the difficulty is as soon as you start putting public information out there, say, well, actually, it's not just these three core symptoms, it could be any of these symptoms, then we will also flood the system with people with literally any symptom anywhere and make it really, really hard to dig down to the ones that are really, really sick. So it's a really difficult one to manage. Because on the one hand, make everybody vigilant as to what's going on with them, but at the same time, we only have a finite system to be able to pick this stuff up. And I think that symptom list is going to get ever longer. And there'll be so much overlap and so much issue with chronic illnesses and the interaction with those in COVID. It's just going to make things really, really hard to manage.
This is probably too early to ask, but have you seen anyone get COVID twice, or are you? I'm kind of a believer that once you get it, you're going to be immune. I know we don't have any research to prove that yet, but have you seen anyone relapse with COVID or get it again or anything?
To be honest, I think in the natural history of where things are in the UK, I think it's probably too early to say. If you look at this as the timeline of China first and then Italy being the next major peak in the development of this thing, I think we're probably too early to say. And who knows? I mean, who knows how many healthcare workers have already had a very, very mild illness and not even had any symptoms at all and got immunity? We just don't even know because we've got no tests to back it up. This is the problem. We are really working in the dark. Mm-hmm. And as soon as I've ordered some antibody tests from China just for my own thing and some people around me. I want to do a test on myself as soon as I can, just to find out where I'm at.
Agreed. Me too. Absolutely. So,
and I will do one every week during this illness as a personal study.
Well, do you have any sensitivity data on that? Do you know how effective the test is?
So the one I've looked at, the sensitivity. Let me just grab my folder because it's the false negative rate, which is the issue. I can't remember something what it is. Give me a second. See if I can get- I have to say, actually, while I'm finding it, the thing on the whole testing is becoming a bit of a laugh because the price of the test kits is going up exponentially. As demand is going up for them, there's
Really?
a sort of racket going on with the prices. So they've already doubled in price
That's
in the last week.
unfortunate. All right, so I guess
Because
that's
the
one
world
thing we're
is-
doing okay in America because we've got more and more test kits coming out, and the price seems to be about the same. If you're going to pay cash, it's running about $150. I think the highest I see is $250. We charge a fee for swabbing, so that adds another fee to it. But I don't think people are increasing their price, and I think yes, the demand is there, but I think enough private companies are stepping up to the plate that they can't really can't extort.
Well, I'm
people.
actually referring to I'm actually trying to get hold of antibody tests, and so the home antibody test kits, which haven't really kind of hit the ground yet. It's very, very hard to pin them down to get a sensible price. They are literally cranking the prices up by the week. Demand has gone bonkers. Whole countries are ordering millions and millions of these things from China, and they can't cope with the demand. So of course they're cranking the prices up.
And I just don't know how much I trust that test from China because I've seen that already. What's your take? Do you trust it? Do you believe it?
Well, I mean, the data I've got is the sensitivity is 87% and the specificity is 98.9%.
Wow. Okay, so that's for anyone watching. That's
well, now obviously
great.
that's not a huge sample, and that's probably all we're going to get because obviously that was done, at source in terms of where this thing whole kicked off, and they've done a fairly early study. But it's just something to go on. It would certainly be very useful.
Well, I think you could at least
I would
clinically test it if you wanted to. You could test yourself and choose someone that's a willing participant and say, "Hey, I will test you for free." In order that already had the illness, and then you can use that as your validation. Like, well, did they pick up the person that already had it or not?
Yeah, absolutely. So I'm hoping I'm going to get my hands on some. And I have a feeling the NHS, the health service over here, are trying to order 3.5 million. I'm not sure where they're getting them from and how quickly they're going to come online, but they clearly see some value in that being a test that will help us to manage this whole thing. And the beauty is you can be done at home. You can get a result in 10 minutes, and you haven't got to get somebody going out of their house to hospital, doing a swab and with all the droplet infection of getting a swab and everything else. So there's many advantages if the data is good enough to support the test being valid.
I'm dying to find out my antibody result. Dying, that's the wrong verb I should not be using, but I'm eagerly anticipating getting my antibody testing because, as I told you, I got really sick in January, which is about the time it was already starting to spread. And because hopefully I'm already immune to it and I will be a little less scared, and then I don't worry about spreading it to my family and loved ones. So we're waiting on the test too. There's a company in the US that's already releasing tests. But it's only like they've released 100,000 and our total population is 328 million. So I don't expect to get any.
Yeah, so there's the problem, and this is going to be the thing. Can they manufacture these things fast enough to keep up with demand? Because it's not a question of most people are going to need more than one. I mean, if it's somebody like me, I mean, if I'm working on the front line, I need to be tested every week. I mean, that's my view at the moment. I don't know. Yeah, we'll have to see what they can come up with.
Any other words of advice or tips or anything you're wondering about in America?
What's the kind of, I mean, so obviously we talked a lot about the medical aspects of all that's going on at the moment. How are people faring? Because, we've literally, our world has changed in the last week. The world has gone into lockdown. You can't go out. You can't do anything. How do you think the Americans are going to fare mentally with this whole thing? And bearing in mind, we don't really know how long this is going to go on for. We've only just started. What's your sense of how this is going to go socially and psychologically on people?
Gosh, that is such a tough question to answer, right? And the as far as just throwing out the mentally part, if you think about the amount of mental illness we already have in this world, I mainly know about in America, the amount of mental illness we have already is astronomical, and we don't have enough care for them. And then you add a global pandemic stressor. I've got very healthy patients who have mild anxiety and their anxiety is going through the roof because of all this. So I can only imagine the people with more severe mental illness is what's going to happen to them, and how much more strain is this going to put, how many more suicides and things are we going to see. There's so much unforeseen fallout that's going to happen. So much of the news right now is focused on, oh my God, the economy, the economy, the economy. But there are going to be real deaths, real consequences, real fallout to this that we don't even see coming. Something happened the other day, and now I can't remember. And it was like, oh, well, I guess that's just not going to happen now because of COVID. And it was because A happened, that B happened, that C happened, that eventually led to Z happening. That's just part of COVID right now. So I'm quite frankly, honestly scared of what's going to happen. And I think the social isolation thing, if I mean, I guess the good news about this peaking and killing a bunch of people is that it'll be over soon. So I think the worse job we do at isolation, the sooner this will be over. So maybe this will end in the next couple of months because we're doing such a terrible job of isolation. But if we can slow the peak down at all, this is going to be going on for 4 or 5 months. And we've never done this experiment before. So many people are working from home, and America is doing the best they can at keeping business as usual going. But let's face it, people are not going out. They're not spending money. They're not buying that new TV. They're not buying whatever. So they're not spending money because they can't necessarily make money. And so the fallout from this, not just economically, but from, as you pointed out, the mental well-being of everyone is tough. And then what about families that are already having strained relationships, a husband and wife that's already having a difficult time, and their sanity was spending time away and then coming together as a therapeutic relationship. And even if they're trying to work on it, you need that time away in order to come back together and work on things. And now they're quarantined at home. So I think there's things like that, like no one saw that coming. There's no way to prepare for that. So how is this really going to work out, and what is the damage that this is going to cause, and are we done? There's already a concern of this hantavirus. I'm sure you saw that, a hantavirus popping out in China. It's a bat to human. Now I think that's just more kind of news media scare, but the fact that these viruses are done doesn't mean we're not going to get another one next month. It's just a sheer probability. The chances of it happening are rare, but the chances of this happening was extremely rare. So I don't know. I'm kind of scared, Dr. Greenland. The world is definitely shook and will be much different after this, and a significant population is going to die. I mean, even if you multiply 1%, let's do some numbers real quick for fun. You said you guys have 50 million people in London.
So the UK is 60 million. The population of London, UK is 60 million. London's, I think about, I'm quoting off the top of my head, around 5 off the top of my head.
Well, let's do 50 million in the UK. Let's say 75% of them get it. That's 37.5 million people that get the virus. Let's multiply that times 1%. That's 375,000 people that are going to die because of this virus. Yeah. That is a huge sweeping phenomenon. Now, if you look back at some of the other viruses that came through, and that's where some of the people that are blowing this over like to say this isn't a big deal. I mean, you look at bubonic plague and all those things. Those did kill an astronomical amount of people. And then people point at this virus and like, oh, it's only killed so many people and it's only killing elderly. We are just at the beginning of this virus. You know, you think of HIV and AIDS, that was a big deal. That was only 40 years ago, and it's still killing people. Obviously, we've got good drugs now, so it's mostly people are dying of heart attacks and strokes as far as HIV patients nowadays. But even still, HIV is still going. What if this coronavirus doesn't just sweep through the world and then end? What if it keeps mutating and keeps coming around? All of a sudden, this death toll goes from just a small 1% to 1% multiplied by 40 years. That's a big deal. This virus is going to kill lots of people. But in this first sweep across the world, I don't know what the global population is, but 1% times our American population is what I do the math, 3 million people. That's a lot of people. That's if 100% of people got sick. But even if you divide that in half, that's still 1.5 million people that are going to die. That's a lot of people. How is this going to affect our economy?
Yeah, no, I totally agree. And I suppose we're all kind of looking and hoping for a vaccine. How long that will take and how effective it will be and how it will stack up with the possible mutations of the virus, who knows? But I suppose that's for our only hope at the moment.
Well, I've certainly appreciated our phone call. I'm sad that we won't get to meet up in our annual nerd conference this year in May. but looking forward to running into you in other conferences. And I would love to do another phone call in a week or two to hear what London's doing and see what tips you guys have for us and what tips we have for you. Sounds like right now you're more useful to me than I am to you. So I'm thankful for your information.
It's useful getting a take from, you know, somewhere distant, just to kind of see, you know, how people are managing it and what your approaches are and what your thoughts are. And it's very useful because it can be very isolating if you're stuck in your own health system dealing with the here and now, and it's very useful to get a sense of what's going on elsewhere. So it's very, very helpful.
Good. Well, you take care of yourself, buddy, and don't neglect your own health, because we need you out there working. And of course, if you get sick, take time off. Do what you have to. This virus is serious, so don't take it lightly.
You take care as well. Really good to talk with you again.
We'll do, and we'll talk again soon. And don't hesitate to hit
Perfect.
me up through text or WhatsApp, and we'll keep chatting.
Absolutely. Okay. Take care.
Bye, buddy. Bye.
So, bye-bye. Bye-bye.